Hey everybody, it's Luke Gordon here again with the introduction to our second yoga video. So Sandy's going to be leading this video again. Sandy Nolting, our physical therapist and certified yoga instructor here at Gordon Physical Therapy. So the first video was all about breath awareness, which is how she led you through how to start your yoga practice, which is applicable to basically any type of yoga practice, whether it's very introductory and beginner or whether it's more advanced. So that was the first video, and in the second video we're going to segue into what she calls your joint freeing series. So essentially she's going to take you through all of these gentle movement patterns, which of course are going to be incorporating your breathing techniques as you go along, but they're going to start with gentle movement patterns throughout your neck and then loosening up shoulders, trunk, down through the hips and then down through the legs, and then she'll come back and finish you with a little closing sequence that will include child's pose. So by and large, or for the most part, people are going to do this sequence still sitting. So again, nice easy segue from that first video if you're still sitting. I did talk to Sandy about it because I'm not the expert in yoga, and sometimes clients will actually do this series laying down, especially if they have a lot of pain and they find it difficult to sit for prolonged periods, or they just have a long problem or a difficulty turning off some of that nervous system pain. So in that case, you could do this next video, you could do it laying down, and in general you would have your legs supported on a chair or a wedge or something like that, and then Sandy would help you modify the different movements. But when you think about the different neck and head movements, you should be able to do them from either position. We might make a video at some point showing you how to do it from the floor specifically, but for now just go ahead and follow along in the seated position or laying down as best you can. And then, like I said, she's going to kind of close this video with child's pose, and then the next video in this sequence is going to be a standing, basically like a gentle standing sequence where you're coming up from the chair and she's walking you through some gentle yoga poses from there. So I'll figure out how to work a video clip program here and segue into this video, and I hope you enjoy watching it and it helps you with your yoga practice. Thanks.
But for now we'll be in the chair. I'm going to move my blanket and I'm going to scoot forward on my chair just a bit so I can be at the edge. So in yoga we call this, and for those who've been with me, you know, the sitting bones, right? You feel those on the base of the chair. You feel the pelvis being level. It's not rocked back. It's not tipped forward. You're not slouched. So we try to bring the spine upright, balancing the weight of the head above the pelvis. The shoulders are broad. And we begin with moving the head. And I'm going to be giving you the breath cues for this. And you might feel it's a little out of sync or not coordinated. So just be aware of that. There is a reason for the direction I'm giving you, because it's the way the body has put that breathing mechanism in place for us, the attachment of the muscles and how things move. So starting with the head, we're going to be inhaling and coming back to center. And then I'm going to have you notice, because the cue is going to be exhaling. Now, the breath police will not show up if you do this in opposite, but it's a little bit easier if we exhale. You might notice the difference with that. And inhale back to center. Then we'll exhale and inhale. Now, you're going to go through your breath rate. I'm going to still do the motion as I'm talking. This would be your breath out. This will be your breath in. You're going to move the length of your breath, breathing in back to center. If your breath is short, your movement's going to be a little quicker than what mine will be. Breath in, back, and typically we go maybe 6 or 8 breath cycles with each of these. Inhaling back, noticing the differences between moving right and left, because they're not necessarily the same. There might be some restriction because of arthritis or injury. Be respectful of that. Inhaling back to center and pause. The next movement is going to be a side bending. When we side bend, you're going to feel that stretch on this side of the neck. You'll inhale back up and exhale. The exhale, the ribs are coming down, the belly is scooping inward. The inhale, everything inflates. It brings you back into upright and alignment. Exhaling as you side tip. Inhale, coming up to center. Again, try not to move more than just your neck. Keep the shoulders, the spine still. Inhaling back up. And one more time each side. Exhaling. Inhaling. Again, try your best in and out through the nose. exhaling, inhaling back to center. And then we're going to lengthen the back of the neck by bringing the chin down towards the chest. Try not to round the spine. We're going to be getting there. Inhaling up to center. You can gently look up, but again, don't strain those structures within the vertebrae. Listen to your body. We are trying to reset habits that might not be serving you with this very subtle and guided practice. Inhaling up, exhaling down through the range that your body can comfortably do. In yoga, we call this effortless effort. One more time, either looking up or back, and then exhale, looking down. Feel the stretch on the back of the neck. Inhale back up to center. We're going to move down to the shoulders. We'll use the arms as part of that process. Inhale with your arms supported on your lap. The palms are up. If there are no restrictions in your shoulder, you can have your arms down beside you. Either is acceptable. Exhaling when the arms come up to the shoulders, and inhaling down. Be respectful of any arthritis within the fingers, so you don't need to make a soft fist, but you can if that's comfortable for you. But just work on inhaling and exhaling. Breath in. Breath out. Again, moving your pace, the length of your breath. One more time. Breath in. Breath out, and keep your hands up either with a light fist or just hands open. And we're going to lift the elbows. Inhaling and exhaling. Breath in. Breath out. We're helping that rib cage as well as the shoulder girdle. Breath in. Breath out. If the arms aren't restricted, you can bring yourself up a little higher. You can be in this pattern up here, and I'm going to give an option of exhaling and inhaling. So it's just a little bit bigger. Again, everything in yoga is modifiable. We can grade the motion, and the important piece is pairing it. Exhale with this drawing in motion, and inhale coming out. Let's let the arms come down if you did raise them. Take a breath in here. Exhale, give yourself a hug, and it can be a low hug. Again, shoulder, neck pain, we don't want to disturb that. Inhale coming up. And if you feel more comfortable, you can raise them. It can be a hug, exhaling, inhaling. You'll notice I'm alternating. This might be a coordination issue, so hang in there. Don't be flustered. Exhaling, inhaling, exhaling. So you notice we're trying to go long, slow breaths. I don't count repetitions. It's not a gym workout. It's a body awareness practice. One more time, inhaling and coming back down. You're going to bring your shoulders up, back, and around. So if you think about taking a breath in and a breath out, and a breath in and a breath out. Good. And then make a light fist and open up wide. Breath in, breath out, breath in, breath out. You might want to shake just to kind of get rid of any tension that you've carried. We're going to come down to the spine now. So you notice we've done the neck, we've done the shoulders, the elbows, the hands. The hands are support on your thighs right now. We're going to do some pelvic and spine patterns. So I'm tipping back on the sitting bones, which makes my spine round. And then when I tip forward on the sitting bones, it brings my spine upright and tall. So when I tip backwards, let the breath out through the nose. When you tip forward, take the breath in. So again, this is called cat-cow in yoga. I don't have to be down on the floor to do that pose because it is a rock of the pelvis and this wave of action through each vertebrae of the spine. Exhaling and inhaling. Breath out. Breath in. Breath out. Move the length of your breath. You might be going a little quicker with me than I am, or a little shorter. And inhaling, coming back up to center. We'll do a twist now. You're going to leave one hand forward and draw the other one back as if you're bringing your hand towards your pocket. You'll notice the belly button turns. And if I pause here, I'm not trying to do motion through my neck, so don't overturn with the head. We deceive ourselves sometimes by making it a bigger or harder motion than what it needs to be. We're trying to go at this subtle level, a gentle ringing action through the spine. I'm going to have you breathe here rather than with a movement pattern right now. Breathing in and out, noticing movement of the rib cage. On your exhale, draw the belly inward, a scooping action in order to really bring the ribs down and to help empty the breath. This ringing action is nourishing for the interior. It helps to kind of get rid of those cellular waste products that our body is dispensing. So ringing helps. And then after your exhalation, inhale back to center, and that helps the system just take in that new oxygen and it circulates in our system. It helps with the delivery of nutrients. We're going to go the other side, keeping other hand forward, and the other one comes towards your pocket. The belly is what's twisting. It's a ringing action around your spine. You're staying upright. You're still weighted on the sitting bones. Feet are on the floor. Following your breath, noticing the expansion that happens through the rib cage on the inhalation, and the drawing in and down with that exhalation. And from your next exhalation, take your inhale, come back to center. We're going to go one more movement pattern with this segment here, and it's a side bending. If you bring your hand to the side of your chair, it'll help give you support. We always call in yoga rooting or grounding. So I don't want to just do a free-for-all side bending. I want to measure it. So I want to keep myself anchored here. If you're able to comfortably bring your other arm up, inhaling, then I'm going to exhale to that side where my hand is on the seat of the chair. I'm going to inhale back up, and I'm going to exhale. I'm going to put that hand down beside me, inhale the other arm up, and exhale. Opening the side ribs, a gentle bend of the spine, inhaling up and exhaling down. Now you can continue with the arm. I'm going to take it out of the picture so that you don't feel the need to. I just inhale. This would be your arm raising if you choose to continue to do that. And I'm exhaling. So notice I can still get opening of the rib. Inhale back upright, ground with this hand, and exhale, side bending. I'm not trying to overdo with my head. I'm trying to concentrate that motion through each segment of the spine. The exhale is my bending. It helps to bring these ribs in, expand these on my inhale as I come up. And one more time, exhaling and inhaling up. We're going to move down now to the hips, the knees, the feet. And you can try this. If this is comfortable, you can bring your knee up towards you. If it's not, then leave your foot down and just raise your foot, your heel up from the floor. So I'll lead it first with my breath in. My breath out is either knee up towards me, inhale down. If you can't raise it, then just exhale, lift your heel up. Okay, so either one of those patterns. Inhale, no movement. Exhale when I'm shortening those muscle fibers and inhaling down. If you're moving the knee, it would be an exhale here and coming back down. We're going to go other side, inhaling, again, maybe just lifting heel, exhaling, inhaling that foot flat. This would be the option, drawing knee up, exhaling with a squeeze, inhaling down. We'll do the same side, exhaling, either lifting heel, inhaling feet flat, or exhaling knee up to chest. We'll go one more time with whichever pattern you've chosen for yourself. Inhaling it down and exhaling, either heel or lifting knee, and bringing it back down. And now, if you're still comfortable, now I've asked that you sit forward on your chair. If your back is getting tired, if you feel like you're fatiguing, you can scoot back to have the support of your seat back to give you that little bit of extra ease for the abdominal muscles. Bringing the leg out so that you're in that position where the hamstring isn't giving you too much grief. So it can be bent knee, it can be straight leg, as long as your pelvis hasn't tipped and the spine rounded. So find that position with that. To get a little extra awareness of the back of my leg, then I'm going to hinge at the hip crease. Notice I don't round my spine. And when I come forward, I notice where I get that sensation of stretch or length on the back of my thigh, maybe into my calf. It'll be different if the toes are pointed versus the ankle being flexed. Breathe here for a couple cycles. And then coming back upright, inhaling, and we're going to move just at the foot. So I'm going to point my foot, taking a breath in. Exhaling, I'm going to flex and bring the toes up towards me. Inhaling as you point, the breath moves the length of the motion. When it transitions, you change the direction of movement, exhaling. Inhale, pointing. Exhale, flexing. Let's go one more time. Breath in and breath out. You can take your foot a little side to side. Notice if you have to use all of the leg to do that, if you can isolate it to the ankle. I exhale when I draw it in. I inhale when I sweep it outward. Exhaling and inhaling. And before we leave the side, take a little ankle circle, inhaling as it comes down towards the floor, exhaling as the toes come up towards you. Inhaling, exhaling, and switch directions. Inhaling, exhaling, breath in, breath out, and one more time through. Breath in, breath out. Bringing that foot back, you might start to notice, and you can see, I think in frame here, difference of color in my feet. Maybe that shows up on the video, and you'll notice that for yourself. Just by this ease of movement, we're improving the circulation with that. So we'll do the second side, bringing that leg out. Again, knee can be bent or leg straight based on the length of your hamstring without challenging your posture of pelvis and spine. And if I hinge at the hip crease, I'm going forward slightly to that place where the back of my leg is talking to me. I'm not trying to go for a preconceived target where I think I should be. I'm really listening to my body, understanding the balance of muscle length in all of these body segments so that they work together and I'm not straining or holding my breath. It should move through my system in any position that I'm in. After 2, 3, or 4 breath cycles, coming back upright so that you can more freely move the foot, inhaling on the point, exhaling on the flex. When we go through patterns like this, we call it flossing the nerve tissue or flossing the connective tissue. It's these long, slow movements, and it's not just isolated to what's happening at the foot. It's really the connection of that tissue all the way up to the sitting bones. It's getting a glide, and if we can create slide and glide of these connective tissue layers, we bring a better level of health to ourselves. So inhaling on the point, exhaling on the flex, and then sweeping inward. Inhaling, sweeping out. Exhaling. Now your range of motion may be different. Don't try to compare. Yoga is about letting go of ego and just being curious what each foot is able to do, one compared to the other, not comparing to somebody else. Finish with some circling, inhaling, exhaling. Can you isolate this motion relatively to the ankle foot rather than trying to steer it with the whole leg, the rest of the body? And then changing directions, your inhale sweeping downwards, your exhale drawing up. Yoga is usually a practice of being barefoot, but you can keep socks on if your feet are cold. We just don't do a practice when our socks are on when we're standing with it. And bringing that leg back And let's try a little Baddha cobbler pose, soles of feet together, and the knees and the hips can open out. We're trying to give them a little bit of a length on the inner thigh and some lubrication at the hip joints itself. You could go back to doing a cat-cow motion of rocking on the back of the sitting bones, exhaling and inhaling, coming upright. Exhaling, pelvis tips back, spine follows, gentle with the head and shoulders. Inhaling. Again, really understand that that breath is cleansing. It's moving through you. It's helping to integrate motion and integrate body, mind, and breath. It brings us into balance to all the systems. We'll come back up, and we're going to finish with a pose that's called child's pose. The legs are wide on your chair. You're going to bring your weight to the back of your sitting bones, so I'm rounding here a little bit. I'm going to bring my elbows to my knees, let my hands relax, and my head is just going to be soft here. You'll notice, hopefully, and sense in your own body that the spine is rounded. Be aware if you have pain, if this is uncomfortable for you, then just come back up to sitting and let your back be supported in the chair that you're on. If this isn't causing any pain, continue to be here breathing. I'm not taking you any lower. There are precautions related to glaucoma and blood pressure, so this is enough to get the benefits of the pose. But notice how your breath changes, how your inhalation expands your rib cage. In the exhale, the ribs draw in and down, the belly draws up and in. The inhale expands. It's like the breath is pushing from the inside out. Let it have the time to do that action. Let your exhale come to that place of feeling empty. Pausing there. Let's do 2 more breaths. When we come up, don't lift up abruptly and don't lead with the head. Bring your hands to the top of your knees. Keep your head down. Push into the floor with the soles of your feet, hands to knees. Inhale, you'll first raise up through the spine and the head comes up last. Exhaling, bring your legs back in, and if you're still forward on your chair, sit back. This is where we would close a practice again with a little shavasana or breath awareness, which I won't lead you through this time. The next segments that we'll film will be a standing practice and a relaxation practice, a stress reduction. So thank you for joining me, and as we say in yoga, palms together, I honor the light in you. Namaste.